Oh, some of the big news this week. The Food and Drug Administration approved the first over-the-counter, no prescription needed treatment to reverse an opioid overdose. It's naloxone, a 4-milligram nasal spray. This is the first naloxone product to be approved without a prescription. And of course, this is going to be very good news for the COO of the Root Center, Benjamin Metcalf. He joins us now to talk more about this groundbreaking medical approval from the FDA. Good morning to you. How are you today?
Good morning. Thank you for having me.
Glad to have you here. Of course, a lot of people know naloxone by its trade name Narcan, something that seems like it cannot be widely available enough given the problem America has with opioids. Just how groundbreaking is this in your opinion?
This is a significant milestone given the continued rise of overdoses on a national level. This medication is safer than an EpiPen. And to allow people to have access to life-saving medication readily available is going to be amazing. I think it helps also address the stigma associated with substance use disorders, as this disorder does not discriminate against any age, race, creed, socioeconomic class. I think this is a game changer.
Yeah, talk to me more about that stigma and how you feel like it's maybe held some people back in the past from getting this medication when they otherwise would not have gotten it, or I'm sorry, not gotten it when they otherwise needed it.
Sure. So previously you had to go to see a provider or a pharmacist that was licensed to be able to dispense Narcan, and folks just didn't do that. They felt like they were going there and going to be judged or questioned about why they were picking up this medication. And now to be able just to go, over the counter and pick up a medication without any questions asked, people will have access to care, which I think really, will help a lot of people, save a lot of lives.
And listen, no doubt this is a good thing. A lot of the questions and concerns I'm seeing from viewers at this point still revolve around that stigma. I think they're worried that the price might be so great that pharmacies are going to start putting it behind glass, which makes it more conspicuous to ask for. Do you find that you're still worried that the stigma is there? I also know a viewer messaged me completely and said, people need to be aware that sometimes when you have naloxone, it goes into your medical record. Of course, it should. But they're even just worried about the stigma of that when otherwise some of these people would have died, and yet that's still there. It's very pervasive from what we're seeing.
Yeah, again, I think stigma, it permeates everything that we do here, and the challenge for us is to try to just explain that this is again is a disorder that's not going to discriminate. It'll affect all walks of life, and this medication really is going to help save people's lives, and there's nothing to be ashamed about. If you're suffering from an opioid use disorder, it's a neurobiological issue. It's not a moral failing or anything like that.
Yeah. What else do we know about this nasal spray? You said safer than an EpiPen, which is good. I know one problem people sometimes have with the EpiPens is that they expire, and so it can get a little expensive. And I know we don't know how much the nasal spray will cost, but do we know how long they last or anything about how well they work?
Yeah, so Narcan works great. I think the shelf life is about a year. I don't believe the cost is too great. The one thing I would caution against is if somebody is using other substances, or depending on the type of opioid that was ingested, one dose might not be enough. People should definitely contact emergency medical services after Narcan is administered in the event that there's something else that's on board. So it only reverses opioids. It doesn't address anything else like benzodiazepines or other substances that might be on board. So we want to make sure that we're providing the medication, but then also getting medical providers involved and that the person's getting the care that they need afterward.
One last quick question, too. You mentioned you want to call 911. Is that just a good idea, even if you know for a fact the person's only on opioids? Because is there a worry that the naloxone would wear off and the opioids would then overwhelm the person's system after that?
Yeah, I would recommend that. I believe Narcan usually lasts for about 90 minutes or so. So if there's other substances or if they've taken a long-acting opioid, you definitely want to get them some medical attention. It might not be necessary, but it's better safe than sorry. You don't want somebody to pass away after you've administered the medication.
Absolutely. Well, Mr. Metcalf, thank you so much for taking the time to join us today. Like we said, undoubtedly good news, a step towards saving a lot of lives. Thank you.
Thank you.